Bacterial pneumonia. What is it? Bacterial pneumonia is caused by infection of Streptococcus pneumoniae, which is a bacteria that affects the upper respiratory tract in humans and can be the cause of several illnesses. Pneumonia can also be caused by viral and fungal infection as well. It enters the lungs where it goes into the air sacs or alveoli. Then it causes mucus to build up, making it difficult for the lungs to get oxygen to the blood, while also making it difficult to breathe. Infection and transmission. Infection can occur through inhaling the bacteria, such as when a person coughs or sneezes, and through the mouth or eyes when you touch a surface that has the bacteria on it. It is also possible to get it while recovering from a viral cold or the flu, and from being in a poorly ventilated building or area because the bacteria is not being circulated out of the area.
Who can be affected? Those affected by pneumonia after contraction are adults 65 years and older, children 2 years and younger, those with chronic diseases such as diabetes and heart disease, those who smoke on a regular basis, and people with pre-existing medical conditions. Clinical signs and symptoms. Similar to those of the flu or common cold, symptoms of pneumonia range from chest pain caused from breathing and coughing, producing excessive phlegm at any color from green to yellow or even bloody. Mental instability causing confusion and deteriorated mental awareness, a lowered body temperature, fatigue causing fainting spells and shortened breath, fever causing shaking or full body chills alongside sweating, and nausea causing either vomiting or diarrhea.
Taxonomy and morphology. The Streptococcus pneumoniae is covered in a polysaccharide capsule that overlays the cell wall made of peptoglycan and teichoic acid. They also form in chains. The changes it causes in the lungs are an inflammation and thickening of the alveolar septa, or the tube that leads to the alveoli, as well as the color of the lungs depending on what stage of pneumonia the person is in.
Diagnosis. Pneumonia affects millions of Americans every year. According to the CDC, over 4,000 people require ventilation. More than 5,000 people die from the disease. But this can all be prevented with the right diagnosis, find what type of pneumonia you have, so it can be treated. Procalcitonin. This is a protein that is released by cells when response to toxins, measured via blood test. Results are usually positive within 4 hours of bacterial infection and be controlled for 48 hours. This indicates that antibiotic treatment will need to be taken. A physical exam. Doctors will take a physical exam, measure the patient's blood pressure, and heart rate. The doctor will use a stethoscope to listen to your lungs for crackling sounds. Pneumonia can perform the rate for decreased sounds. The chest x-ray. If pneumonia is expected based on symptoms and physical exams, the standard is to get chest x-ray. The chest x-ray may show infiltrate, which is collection of blood or protein in lung tissue. Treatment for pneumonia varies on your age and overall health. People who have pneumonia can be treated from home medication. Although symptoms wear off in a few days, the symptoms can last for months. To treat patients, doctors use Zithromax, paracetamol, and aspirin. Zithromax. It's used for adults under age 65 and it's commonly used with a combination of amoxicillin. It's a versatile antibiotic used to treat many infections, including skin infections and sexually transmitted infections. It's also available in pills or injections. Paracetamol. If you're experiencing chest pain, it's best to use this painkiller. It's to be used to reduce fever. There's also an ingredient in paracetamol called acetaminophen that may cause side effects and require immediate medical attention. Aspirin. It can reduce the risk of heart attack and stroke in people and guard against cardiovascular. In 2015, 1,005 patients were included in the study. 390 patients were receiving aspirin, whereas 615 were aspirin-free. During the follow-up, 16.2 patients died. Among those 90 were aspirin users, 144 were non-aspirin users. The study showed that chronic aspirin use is associated with lower mortality rate. With 30 days after hospital admission in a large cohort of patients with pneumonia.
Disease progression. After contracting pneumonia, the disease can progress through your body from 1 to 4 stages. Stage 1, congestion. This occurs within 1 to 2 days of initial infection and can last throughout the entirety of the infection period. Lungs begin to look red and swell as more bacterial cells are produced than white blood cells, and blood flows to the lung. Blood flow to the lung is increased. Stage 2, red hepatization. This occurs within 2 to 3 days of the initial infection and can last from 2 to 4 days, dependent on the severity of the pneumonia you have contracted. Affected lungs resemble the liver as they become granular, dry, and airless, making it very hard to breathe. Airways also become blackened by the bacteria, white and red blood cells, alongside with cellular debris. Stage 3, gray hepatization. This occurs within 4 to 6 days of the initial infection and can last within 4 to 8 days. This is considered the worst stage as the affected lungs begin to change color into a yellow or gray tint. Macrophages or large white blood cells form during the breakdown of the red white blood cells and hemodesirin, an iron storing protein in your tissue. In continuation, stage 4, recovery. This stage may or not happen depending on how you progress through having the disease. Fluids are absorbed into tissue cells, macrophages eradicate white blood cells and debris could be coughed up as the airways return to normal. Adverse recovery and complications. During this stage, some people may have some overlying symptoms after releasing the disease from their body. Acute respiratory distress or ARDS, respiratory failure, kidney, liver, heart damage failure due to a loss of oxygen, remaining lung swelling causing chromic lung disease, which leads to narrowed airways and pleural adhesion. Percentages and possible outcomes. These percentages and possible outcomes are tallied up from over 100,000 people. People who contract pneumonia could have survived with symptoms or be deceased. This is with medical aid or without medical aid. Those with medical aid above the age of 60 years old that survived were 30 to 40%. 85% survived were those between 65 and 5 years old, and those under 5 years old were 25 to 30%. Those survived with symptoms with medical aid, 60% above the age of 65, 15 to 20% for those between the age of 65 and 5, and 20% to 45% for those under 5 years old. Those deceased above the age of 65 years old were 60 to 70%, which is 50,000 plus adults. 15% for those under 65 and over 5 were 15%, and those under 5 years old were 70 to 75%. Those without medical attention from survived to deceased had a greater chance of dying by over 15% or a lower chance of living by 10%. Those who survived without medical aid were 20 to 30% above 60 years old, and under 5 years old were 10 to 50%. Those between those ages had a very increased chance of living, which is 60 to 70%. Those under 6 years old, under 5 years old who survived with symptoms were 30 to 45%. Those between the ages of 65 to 5 years old were 25 to 30, and those who survived with symptoms are 0%. Those deceased without medical attention were 70 to 80% of adults 65 years or older, 85 to 90% for those under 5 years of age, and 30 to 40% for adults between those ages. Zoonotic concerns. A zoonotic disease is one defined by its ability to transfer between humans and animals, but that is not only it. Pneumonia is only defined as a zoonotic bacterial infection due to its ability to transfer between animals and humans and vice versa, but at an increasingly low rate, making transmuted infections nearly impossible. This means that yes, while pneumonia can travel between humans and animals, its likelihood is very, very slim. And although it can do that, its chances of causing a deadly infection are very low. Low rates of transmission make this type of pneumonia as a zoonotic disease non-existent. Is pneumonia a reportable disease? Pneumonia is considered an infectious and potentially serious bacterial lung disease that can be contracted by nearly anyone. Because of this, pneumonia is notifiable and should be reported within 4 days of recognition by the CDC. While pneumonia is contagious, it isn't ranked high on a scale of reportable diseases or contagious diseases. The bacterial type of pneumonia heavily determines if it is a contagious disease alongside its severity. However, those exposed to the bacteria that causes pneumonia may not contract the disease itself. Questionnaire. Question 1. At what percentage would someone at the age of 70 years old survive pneumonia while still having symptoms without medical aid or attention? 85%, 60%, 15 to 20%, or 25% to 30%?
Question number 2. What type of microbes can cause pneumonia in humans? Bacterial, viral, fungal, or all of the above?
Question 3. What would doctor use if he hears cracking noises inside your lungs? A, chest ray, B, Zithromax, C, stethoscope, or D, aspirin?
Thank you for taking part in our presentation.